Hello everyone, and welcome back to This Week in the Clinic. Thank you so much for joining me again. This is where I take what I learn in the clinic throughout the week with clients working with actual humans, right, in the flesh and blood, and bring those lessons to you so that you can improve your life and health and learn from real life successes and things that I learned, working with people with all sorts of health issues. So again, thank you so much for joining me. If this is your first time joining me, just want to introduce myself. I'm Gitalis. I'm a clinical nutritionist and functional medicine practitioner. I have a clinic here in Toronto, which I own and operate. And we also work with people all over the world. So that's how I spend part of my time. The other part of my time, I spend educating people. I have a very strong passion for teaching. So I have a full functional nutrition certification program. As well, I run a variety of courses. And of course, I meet with all of you on Facebook every Friday at 10:30 to discuss the lessons that I learned this week in the clinic. So again, thank you so much for joining me. If you know someone that will benefit from this cast, you are more than welcome to share the link. That would be very helpful to get this information out to many. And also, if you're watching on your phone, you can just let me know that you're with me, you're following by giving me a like, and of course it's a little bit different when you're on a computer. I think when you're on a computer you can like it once, but when you're on the phone you can like it multiple times, just so I know you're there. And as we go along here, you're welcome to make comments. I am following along here on my computer. I just have it on my desk in front of me. You're welcome to make comments, you're welcome to post questions, and I'll try to deal with them to the best of my ability. So again, thank you all so much for joining me, and today I'm super excited to talk about vitamin D. Vitamin D is a critical nutrient. It's an essential nutrient, of course, and it has such a wide variety of application in the body and in health and in disease prevention, which we're really going to dive into pretty deep here, look at some really compelling research. And I hope that when you're done here, you walk away with first of all, a really great understanding of why vitamin D is so important. When I'm working with clients and when I'm teaching, I always emphasize the why. I never give a supplement, a dietary recommendation, a therapeutic food, a lifestyle recommendation, any recommendation really, without explaining the why behind it. And when we understand the why, the how takes care of itself. That's at least what I believe. And that's why I like to spend a lot of time on the why. Then we will move into the how. How do we actually monitor our vitamin D levels? How do we, keep them at the optimal level and, maintain health that way? So we're going to go on a bit of a journey here, and you can see in the itinerary, if you saw here that I posted in Facebook, we're going to first talk about the occurrence of vitamin D deficiency. Like, how common is this really? I get a lot of people telling me, I work with people all over the world. So I work with people up here in Canada, and I work with people who live in hot places. And they say, it's sunny here all the time. Do I really need to take vitamin D or check my levels? And we're going to see why that probably is necessary. We're going to look at the connection between vitamin D and a whole bunch of different diseases and conditions. We're going to look at what the research says. Am I making this up? No, I'm not making this up. There's tons of research backing up what I'm going to be talking about today. We're going to talk about why vitamin D isn't a standard test, and we'll also hone in a little bit on why Health Canada took it off as a test that's covered by OHIP. That's our socialized healthcare plan here in Canada. We'll also talk about what the normal range is versus the optimal. So there's a big difference between the normal and the optimal. And then I'm going to give you some tools for you to walk away with. When you're done, I want you all to be a vitamin D expert. In other words, I want you to know how to manage your vitamin D levels within you, and also to advise other people on how, whether you're a parent, a friend, a family member, or whatever. So I see some people have checked in here. Pacifica, this is so missing from patient care. Yeah, it absolutely is. That's why we're going to touch on it. And a big part of this too is I like to help you, and the reason why we do this week in the clinic, I like to help you be your own practitioner. it's just amazing the abundance of information there is out on the internet now. I was just having a chat with one of my clients yesterday, and he said, he's like, I don't know how people went through the process of being diagnosed with a disease and going through the healing process like 20, 30 years ago. So we have all these amazing resources out here on the internet, and we can really take control of our health. In fact, you can even order your own labs online these days, and I'm actually going to give you a resource in which you can order your own labs today. So we're in a new era, and we need to move more from a disease-centered healthcare model to more of a patient-centered healthcare model. And when we do that, the patient, the client, you become in charge of your health. No longer is someone else in charge of your health. No longer do we go and say, hey, you know, what's the status of our health? We have to do that, and that's why this is so important. And we have to seek out that information. So that's what we're going to cover today. I see Maya is joining us. Karen White has also joined us again. So this is going to be, we're going to cover some great information here. So let's just start by talking about some of the statistics, okay? Is there actually a vitamin D deficiency? Sorry, I'm just fixing my computer here so I can see the comments come in. Okay. Oh, Lori's joined us too. That's great. So first of all, just going to read you a couple statistics here. Vitamin D deficiency is a worldwide epidemic, with recent estimates indicating greater than 50% of the global population vitamin D deficient. 50% of the global population. That's a huge, huge number. I guess that's 3.5 billion people possibly deficient. A high prevalence of vitamin D deficiency has been found across all age groups, in all populations, studied in countries around the globe. So at no age are we immune to it. In no population are we immune to vitamin D deficiency. That's why they're so important. Then we can actually hone in on some higher risk parts of the population. 3% of US African Americans fall within range, and 63% of them are below 50 nanomoles. So when people, most people understand that we make vitamin D when we're out in the sun, right? We go out in the sun hits our skin, it turns a cholesterol-derived molecule into vitamin D. That vitamin D gets absorbed through our skin into our bloodstream over about 24 to 48 hours, gets into our bloodstream, goes to our liver, gets converted into 25-hydroxy vitamin D, goes to the kidneys, gets converted into 125-hydroxy vitamin D, and then we have vitamin D. So it all begins with the sun. So the darker our skin, the harder it is to actually make vitamin D. So population groups that have darker skin are going to have a much harder time. That's why they've honed in here on US African American population. But we are all at risk, as I mentioned before. 50% of the population is going to have low vitamin D levels, which is why we all have to pay attention here. Obviously, too, depending on where you're living, higher latitudes you're going to be at higher risk because you're outside in the sun a lot less. Now, if you live in a hotter climate and you're exposed to the sun a lot more often, does not mean you're going to have good vitamin D levels. We can't assume anything. We have to test, not guess. Example, I had a client who was a marathon runner in California, obviously running outside pretty much daily in the sun. We had her vitamin D levels checked, and we found out that she was below normal. Okay? So there's optimal, and then there's normal. Sorry, there's normal, and then there's optimal, right? Very different, very different. So she was below normal, the medical reference range, she was below that. Now, as I go on here, I'm going to use some numbers. I'm going to talk about vitamin D blood levels. And I'm going to be speaking in Canadian units. Why? Because I live in Canada. So, And a lot of the world also uses Canadian units. The US, I know, uses a different type of unit, so I'm going to be talking about nanomoles. And to do the conversion for US units, you have to divide by 2.5. Pretty easy conversion, but I'm going to be using Canadian units here, talking about nanomoles. So before I move on, I'd like to discuss some of the research. Some of the research behind vitamin D deficiency and what it actually means for us, okay? And what does the science say in terms of its effect? Well, first of all, let's just look at vitamin D's connection to mental health. And why am I making the connection between vitamin D and mental health? You might be like, well, what is isn't vitamin D just for bones? No, it isn't. Yes, it is important for our bones. So if we're vitamin D deficient, about 30 to 80% of calcium goes right through us. We can't even hold on to that calcium. Vitamin D is important for holding on to calcium, reabsorbing calcium, digesting it, and assimilating it into the bone. So yes, it's important for our bones, but that's not the only thing. In fact, every single cell in our body have vitamin D receptors. In fact, there's two things that every single cell has a receptor for: vitamin D and thyroid hormone. So vitamin D is super, super important for every cell, as you can imagine. We know the bone story with vitamin D, and we're going to revisit that in a moment. But I want to bring forth some connections that most people aren't quite aware of. Now, why am I talking about vitamin D and mental health? Well, what many people don't know is that depression is the leading cause of disability worldwide. I'm going to repeat that for you because this blew my mind the first time I heard it. Depression is the leading cause of disability worldwide. It's a very taboo thing. A lot of people don't talk about mental health. And, people kind of suffer in silence, right? But it's affecting a lot of people. And as I mentioned earlier, 50% of the population are vitamin D deficient. So something's going on here. So let's look at some of the functions of vitamin D. So vitamin D receptors are actually concentrated in the hypothalamus in the brain. And the receptors influence nerve growth factor, so how much our nerves can actually make connections. It's called neurogenesis. Receptors influence acetylcholine, serotonin, testosterone, and thyroid hormone. And these are all implicated in depression. Okay, and you might be thinking, well, Josh, that's all interesting if you find receptors in the brain, but what does that have to do with depression? Do we actually have some evidence on that? So we do have some evidence, and there was a study published in the International Journal of Neuropsychopharmacology in 2000 by McLeod and Golden. And what they did was they looked at 441 depressed Norwegians, 441 subjects. And what did they do? They had 3 groups. One group, they gave 40,000 IUs of vitamin D per week, once a week, for a year. Okay? So the RDA, the recommended dietary allowance that most governments are telling their citizens to consume, is about 200 to 800 IUs per day. So this is 40,000 IUs per week, because we actually absorb it pretty well, so we can do mega doses at one time. It's not the best way to do it, but that's a discussion for later. So one group got 40,000 IUs per week, another group got 20,000 IUs once a week, and the third group was a placebo. Okay? They did this for 1 year, 441 depressed Norwegians. After 1 year, the group that was on 40,000 IUs per week had a 33% decrease rating of depression. The group that was on 20,000 had a 22 decreased rating of depression, and the placebo group actually had a 5% decrease. So we actually find this a lot with studies on mental health and depression, anxiety, and things like that, that the placebo effect has a large role to play. So we actually have to factor that in. But the effect above and beyond the placebo effect, because the placebo is about 5% here, was substantial, significant, statistically significant. So we can see there that simple intervention, vitamin D, made a huge difference for these people's quality of life and their mental health, okay? And how many people now going into February soon haven't seen the sun in a while and start to experience what we call seasonal affective disorder, which has actually been linked to vitamin D deficiency? Well, we're outside in the sun in the summer, we're making vitamin D. Vitamin D will last in our body for about 3 months. We're getting to that point where we're using up those stores, so people are starting to feel a little blue. I think this past Monday was like the most depressed Monday in the world or something. I don't know how someone figured that out, but that's what went down. So that was one study. Another study in relation to mental health as well looked at 5,006 individuals between the age of 66 and 96, so a little bit older. They were living in Iceland, so again, higher latitudes, okay? And what they discovered was there was a direct correlation between vitamin D status, so what the vitamin D levels were in these individuals' blood, and how depressed they were. Okay, so we see a very strong connection between vitamin D and mental health. For those of you who joined us a little bit late, we are talking all about vitamin D, and we're giving you a toolkit. We're giving you the facts and the why behind why vitamin D is so important, and then we're going to go into what to do about your vitamin D levels. We're just talking a little bit about the science and evidence behind it right now. And I want to say, I see those thumbs up. I see those happy faces. Thank you all so much for your support, and lets me know you're out there and listening and taking in the information. So I'm just going to check in here on online and see if any comments are coming in. So when is the best time of day to take the supplement? Does it need to be absorbed with something else? I'm going to get there when we talk about supplementation, Candace. Thank you for bringing that up, though. I believe that about depression. Don't have to tell me twice. That is very true. Is taking a vitamin D supplement as effective as getting actual vitamin D from the sun? This is a great question, Mary, and I will address this right now. Yes, it is. Okay. Now, obviously, we want to do stuff as naturally as possible, but we can actually measure blood levels of vitamin D quite effectively, 25-hydroxyvitamin D. We see that both taking a supplement, and I'm going to talk about supplements in a moment, and going out in the sun are effective. If we want to get enough vitamin D from the sun, we have to be outside 1 o'clock when the sun's at its highest, 10 to 20 minutes every single day in shorts and a t-shirt. That's not practical for most people, so we have to supplement to really get the vitamin D levels that we need. We also get a little bit of vitamin D from mushrooms. You'll get some from fish. Of course, certain supplements like cod liver oil are going to have vitamin D in it, but usually, again, not enough to get your blood levels up to the optimal level. And I spoke about earlier in this Facebook Live that the darker your skin, the harder it is to actually make vitamin D. So we were talking about U.S. African Americans, 3% of them actually fall within the range of normal vitamin D levels. That's substantial, right? And that's because they have darker skin. It's harder to make the vitamin D. And of course, if you have lighter skin, the longer you're out in the sun, the more you tan, and that actually works as a protective mechanism in the body so that you don't overproduce and also that you don't burn, okay? So we have these wonderful mechanisms built into our body to actually protect us from ODing on vitamin D from the sun. Okay, doctors really need to be educated, Karen's mentioning, yes, that's why I'm doing these. Okay. How does someone know how much vitamin D to take, Natalie asked, and I'm going to get to that shortly if you just stay tuned. We're going to talk about it. Dark skin tone, we need lots. How much is too much? I take 3,000 IUs per day. We will talk about that in a moment. Why do some vitamin D supplements also contain K2? Better absorption. Well, it's another fat-soluble vitamin, and it should be balanced with vitamin D as well, as with all the nutrients, right? Yes, we are honing in and talking about vitamin D, but every nutrient's important. We're just not doing a whole course on every nutrient today. So they all have to be balanced. So I'm going to move on to one more study, and then we'll move on to what happened with Health Canada and the research, and then I'll give you all the information on what you actually need to do and the practical stuff here. So another study, this one blew my mind as well, was published in the Archives of Internal Medicine in 2000 by Prabhala, Garg, and Dandana, and they were actually looking at specific cases. They were looking at 5 cases of severe myopathy. So all of these 5 individuals were actually confined to wheelchairs. Okay, and what they found, actually one of them was 37 years old, so quite young. This individual was in a wheelchair because of a myopathy. All 5 of them were, but including this 37-year-old. What they discovered was that they all had vitamin D deficiency. They gave them therapeutic doses of vitamin D, and within 4 to 6 weeks, 4 out of the 5 had almost complete recovery and were out of their wheelchairs from myopathies. The 5th one took a little bit longer, but he had a complete recovery as well. So this is another study showing how important vitamin D is for myopathies and so much more. So this is actually a chart. How many people are dealing with pain, right? How many people are dealing with all sorts of pain? Did you know that there's a correlation between vitamin D and pain? So there's a chart here, and basically what it's showing is it's showing pain levels and serum level. And as your serum level goes up, pain ratings go down. How's that? So we've got people in over 90 nanograms per milliliter. That's a very high amount. That's the US unit. And they have the lowest pain rating. So look at that correlation. So a lot of people dealing with pain as well. So correlation between vitamin D blood levels and pain response. Okay. So let's talk a little bit about what happened here in Canada. So I'm often recommending my clients to go get their vitamin D level tested, and doctors are often giving them a hard time when they ask for that test to be done. Why? Well, a little bit of history here in Canada. In 2004, there were about 29,000 vitamin D tests recommended across the country. 29,000, that's not a lot, 2004. Research started to come out. We saw it in the paper, we saw it in the news, we saw it online. People started to become aware of how important vitamin D was and is, and they started to ask way more often for vitamin D tests. It was covered by OHIP, so doctors would continue to request them. In 2009, 700,000 vitamin D tests were requested. So Health Canada had to do something about this. What did they do? They took it off the roster of tests that were included in a doctor's visit if you wanted it done. I know, doesn't really make sense, but that's what happened. So less people were getting tested, and now we have to ask for it. Here in Canada, if you want a vitamin D test that's covered by OHIP, you need to be at risk for vitamin D deficiency or something related. So it's free for people who have osteoporosis, osteopenia. Of course, we know the vitamin D and bone connection. For people who have rickets, we'll talk about that in a moment, malabsorption syndromes, renal disease, and patients on drugs that affect vitamin D. So those are the only people it's free for. So we have to ask for it. So getting to the practical part of this, everyone should know their vitamin D level. It's, you go to a doctor and cholesterol is like a standard test. We should know our vitamin D levels like we know our cholesterol number. That's how important it is. So some practical steps here is we want to get tested about every 3 to 6 months, okay? Because it takes about 3 months for our blood levels to rise. If I start supplementing today on vitamin D, it'll take me about 3 months to see the effect of that. We want to test every 3 to 6 months. Where can we get tested? So here are our options. One option is to go to your doctor, no matter where you are, and ask them for a vitamin D test. Some of them are going to say, sure, no problem. They're going to put it on, covered by insurance, all good, no issues. Some are going to give you a bit of a hard time. Then you can offer to pay for it. And usually they'll requisition it at that point. From what I know here in Canada, labs are charging people between $25 to $50, depending on the lab. I've heard all levels. So that's one way we can do it. Another way we can do it is we can go to a naturopath or a functional medicine practitioner who often have access to labs where you can request it. You'll probably have to pay for it too in that case. And then we have the do-it-yourself method. So there's actually 2 websites that I know of. You can actually order your own vitamin D kit. One is Grassroots Health, which is a wonderful resource for vitamin D. Catherine, my assistant here, is going to post up a link for you guys for Grassroots Health, where you can actually order your own kit. Very simple to do. They give you a little lancet, pokes your skin. You don't have to go get your blood taken or anything. You put it on a little piece of paper, send it back in, you get your blood test results. Don't have to go anywhere. And then there's another website, Vitamin D Council, where you can also order a kit directly from them. Same situation. So you've got many options in order to check your vitamin D levels. You can go to a doctor, a naturopath, functional medicine practitioner, or you can order a kit on your own. And that way you can really monitor to figure out what your blood level is over the long term and figure out what your optimal range is for vitamin D, okay? So we want to get in the optimal range, which I'm going to cover in one moment here. Some people require 2,000 IUs to stay within the optimal range. Some people require 10,000 IUs to stay within the optimal range. So when people ask me, oh, is 3,000 IUs or 4,000 IUs enough? I say, I don't know. Probably a good maintenance, probably a good thing to do in the meantime, but we have to check, not guess, right? We can, and it's super simple, not that expensive to do either, and this can be literally life-saving in terms of preventing disease. The kits that you order from these places cost, I think they're $50 US. So depending on where you are, you can do the conversion. So, you know, vitamin D tests are ranging between $30 and $80 depending on where you get them from. Okay, now let's talk about what you're actually going to be looking for in terms of normal range versus optimal range. So if we look at any blood test result, you can actually see the reference range right there. I always recommend that my clients get a copy of their blood work. And you can see the reference range right on the page. So for vitamin D, most labs have a reference range of about 75. Now we're talking about nanomoles. This is the Canadian units in a lot of the world. If you're in the US, you want to divide by 2.5. So we're looking at 75 IUs, 75 nanomoles to about 200 or 225 depending on the lab. So 75 to 225. Now that's the normal range, and when they're talking about the normal range, they're trying to prevent rickets. Yes, rickets. And is it a successful range for preventing rickets? Absolutely. And there's a wonderful chart here. You can actually get this on grassrootshealth.net. And basically what it's showing is up here is the reference range, the blood level, okay? They're using Canadian units here. In this column are a whole bunch of different diseases and conditions. And then what it's showing here is where your blood level has to be in order to decrease the chance of getting that disease, okay? So if you're at 75, you can see here if you're at 75, you have a 99% decreased risk of getting rickets. That's fantastic. But if you're at 75, you have a 30% decreased risk of getting breast cancer. If you're at 135, you have an 83% decreased risk of getting breast cancer. Now, for the women out there, and actually men too, men get breast cancer as well, would you rather be at a 33% decreased risk or an 83% decreased risk based on the research that's available? Okay, so that's one example regarding to breast cancer. Now we're talking about the normal range versus the optimal. So remember, normal, their limit is 75. If you have a 75 nanomoles of vitamin D, they're going to say, oh, you're doing great. It prevents rickets, but it doesn't really prevent breast cancer in a way that you would want to prevent it. What else do we have on this chart? We have cancers all combined. We have ovarian cancer, colon cancer, non-Hodgkin's lymphoma, a couple autoimmune diseases like type 1 diabetes, multiple sclerosis. And the list goes on, so you can understand how important vitamin D is for modulating the whole immune system. So the consensus here is that over here in this little orange box, it says the optimal range is about 100 to 150 or above. I like to get people within about 125 or up. And that way, we're on this side of all these diseases and conditions, and we're preventing them years before they may even become a problem. And I posted a study a while ago on my Facebook page showing if we got vitamin D levels up for women specifically, thousands of women's lives would be saved that may have passed away from breast cancer. So this information has profound effects on people's health and people's lives. Okay, so that's a wonderful chart. You can get that from grassrootshealth.net. Awesome. And we're talking again, if you're joining us a little late, about vitamin D, and now we're covering the normal versus the optimal range. Okay, and then there's another fantastic chart on disease incidence, prevention, and pregnancy. Okay, so how important is it for a pregnant woman to have good vitamin D levels, both for her health and the health of her fetus, and the health of her child once that child is born? So we have huge decreases in the incidence of a number of issues associated with pregnancy when vitamin D levels are in the optimal range. Preterm birth, hypertensive pregnancy disorders, so high blood pressure when you're pregnant, gestational diabetes, bacterial vaginosis, depression, right? So we talked about earlier the connection of vitamin D and mental health. This is also something that we cover in detail in my course on mental health and neurology. That's the next course we're offering. Impaired muscle strength and postpartum depression. How many women experience postpartum depression? So women with postpartum depression, when their blood levels are above 80, so not even that much higher than the lower end of normal reference range, they have a 43% decreased risk of getting postpartum depression. This is significant information here. And then we even have outcomes related to the children of those women. So decreased rates of the common cold for a baby, ear infections for a baby, lung inflammation, and asthma when vitamin D levels are in the optimal range or above about 80 nanomoles. It's all here. The research has been done. This is important information. So you can see how critical it is to really make sure your vitamin D levels are about at least 125 to about 200 nanomoles, right? That's the Canadian units. To make sure that you're preventing all these diseases and not working with a deficiency, a functional deficiency that's going to cause a whole variety of symptoms. We've talked about how it's associated with depression, increased experience of pain, all types of cancers, autoimmune disease, infections in children, and the list goes on. So how do we supplement? We can go out in the sun if that's available to us. That's one way, obviously the natural way to make it. We can eat fish, Fish is going to have some vitamin D. We can eat mushrooms. They'll have a little bit of vitamin D. In fact, here's a very interesting fact. If you have a fresh mushroom and you put it upside down in the sun and let it dry out in the sun, it actually makes its own vitamin D. Shiitake mushrooms have been shown to make up to 40,000 IUs of vitamin D per mushroom from suntanning. So mushrooms can suntan. But possibly the main way we are using vitamin D in the clinic is in drop form, okay? So I've got 2 here. We used both of them, and I like these. We've got one by Now Nutrition. I can give you a close-up there. Now Nutrition. We've got one by CanPrev. I like these because all that's in them is vitamin D3, the active form of vitamin D, and a carrier oil, like a medium chain triglyceride is usually what they use. So that's all that's in there. Each drop in these is 1,000 IUs, and when you're having people take up to 10,000 IUs to replete their levels, 10 capsules can be a lot at one time, so I prefer the drops. You can do it right into the mouth, you can do it into a shake, a drink, on your food, anything. Super easy to take, also really easy to sneak into the meals of children, if you're trying to get vitamin D. It's basically tasteless and super easy to do. So I recommend drops, very simple. How do we know how much vitamin D to take? We have to get our blood levels checked, and then we can figure that out based on those blood levels. Again, there's really great charts to figure out these levels at Grassroots Health, the website we shared with you earlier, or work with a natural healthcare practitioner to figure out that right dosage for you. They should be able to help you out. And check your blood levels every 3 to 6 months. We talked about how to do that. Go to your doctor, go to your naturopath, go to your functional medicine practitioner, order a kit online yourself. And that's going to make a huge difference for you and your family and whoever gets tested. So I'm going to check in here online, see what I've seen a ton of comments coming through. Esther is asking me, you don't like D3 to be balanced with K2? This, I never said that. But that's something that I don't usually do in supplement form. Sometimes I do. So actually CanPrev has a vitamin D3 and K2 combination. But when the K2 is in there, there's a lot less vitamin D. So I might supplement K2 separately. The K2 might be in a multivitamin. Or I might have them eating lots of green leafy vegetables, which is a natural source of vitamin K1. K1 then goes into our gut, and our friendly bacteria, if we have a healthy microbiome, converts vitamin K1 to K2. And then we have K2, right? So also ghee is a good source of K2. Some animal foods are going to be good sources of K2. So yes, we always want to balance all of our nutrients. Vitamin K and vitamin D, very important to balance out. Also vitamin A, we want to make sure we have good vitamin A levels when we're dosing vitamin D. Question by Maya, what would be the difference between a drop and a tablet? There's no difference really, it's just that vitamin D, 1 drop, 1,000 IUs, takes up such a small amount of space. It's just super easy to take it as a dropper or as a drop rather than a capsule. If someone's taking 10,000 IUs per day to get their blood levels up, that's 10 capsules. Like it becomes a lot, and it becomes way more expensive. When you're getting it in drop form, way, way cheaper. So that's definitely my mode of choice. Question from Robin, what about someone who has cancer? Do they need more vitamin D? There is definitely association between low levels of vitamin D and cancer. As we saw in the chart, all cancers are associated, or low vitamin D are associated with all cancers. They increase the incidence. So yes, there's definitely a connection, but you have to check blood levels. So can someone who has cancer or who had cancer have good blood levels of vitamin D? Absolutely. That's why we need to check and not guess. Okay? So yes, there's a very strong connection between vitamin D deficiency and cancer. But again, we want to see what's in that person's blood rather than guessing. Okay, thank you for that question. Just working my way down here. Okay. Should women supplement with vitamin D while pregnant? Absolutely 100%. They should supplement with vitamin D while pregnant. Super important, as we saw, there's a whole chart dedicated to women in pregnancy and their offspring. But again, we don't have to guess. We need to test blood levels and make sure they're within the optimal range. Grassroots Health says that most pregnant women need to supplement at around 7,000 IUs to ensure that their child, who might be breastfeeding, their infant, first of all in gestation before they're born and afterwards, has enough vitamin D. So they say about 7,000 on average for a pregnant woman or a lactating woman. But again, we can get that tested as well. Okay. Just moving along here on some of the questions. Okay. Okay, I don't actually see anything that I missed. I guess there's a question here from Karen. Are there any other symptoms of vitamin D deficiency besides possible depression? Yeah, there's a ton of different symptoms. That's what I was actually showing on the chart. So, you know, it could be anything. And we also have to understand that vitamin D regulates the whole immune system. So there's a lot of ways we know vitamin D is going to affect us. There's a lot of ways we don't know. Vitamin D is also important for thyroid health, which I didn't really get into in too much detail. I did mention it earlier on. So thyroid is the thermostat for our whole body. If the thyroid isn't working properly, none of our cells are working properly. So we want to make sure that we have vitamin D for that. It's just so important for so many aspects. There's a question here. Is there a correlation with vitamin D levels and miscarriages? On this chart specific to vitamin D, they don't mention anything in terms of miscarriages. I would have to go back to the research and see if there's something out there based on that. But I would presume that that would definitely be something you'd want to make sure that you have good blood levels up before even trying to conceive. Whether there's a direct correlation with miscarriages, I actually don't know that offhand. Which cod liver oil would you recommend? Cod liver oil. Carlson makes a great cod liver oil. There's also a fermented cod liver oil available. I forget the name of the company at the moment. I don't use a ton of it. But yeah, just make sure you're getting it from good fish sources. They're molecularly distilled. They're using processing techniques that actually take out all the heavy metals so that you're getting a nice clean cod liver oil. Time of day to take the supplement. Right, I said I'd get back to this. So we want to take vitamin D with a meal. Doesn't matter if it's breakfast, lunch, or dinner. That's going to increase absorption. It's a fat-soluble vitamin. Therefore, if we eat it with fat, it's going to help with absorption. Don't really want to take vitamin D on an empty stomach. Not going to be as absorbable. Take it with a meal. Doesn't matter which meal it is. It can be breakfast, lunch, dinner. Vitamin D is very easy to absorb. And that's why actually in one of the studies I mentioned, they use these mega doses 1 time a week. Now, I've seen some other research where that's probably not the best way to supplement. I prefer someone taking it on a daily basis rather than 1 time a week. If they forget, they can double up, but we want to do it more regularly rather than these big mega doses. So any time during the day is fine. Can heart palpitations be caused by low vitamin D? You know what? I don't know. I don't know if that specific symptom would be related to a vitamin D deficiency. I haven't seen any research. Usually they're not looking at such specific symptoms, but a lot bigger illnesses. Maya says Carlson. Yes, Carlson was the company that I recommended. The fermented cod liver oils from Green Pasture, Catherine reminded me. Thank you very much for that. Yeah, and I think we're going to wrap this up. Oh, I have another question come in. I take it with a meal. I drop 5 to 10 drops into my liquid fish oil progressive. Yeah, that's a really good way to do it. So to summarize a little bit about what we spoke about today, we spoke about how we started out by discussing how 50% of the world's population is possibly deficient. Actually, I'm going to jump just back on here on a comment here from Maria. A 16-month baby needs 400 IUs. Do you recommend that dose or a higher one? My baby is also taking cod liver oil. It is higher in DHA. Yeah, so cod liver oil is a nice way to deliver the vitamin D. In terms of dosage for our little people, Grassroots Health recommends 1,000 IUs per 25 pounds of body weight. So if we're dealing with, infants, which are obviously less than 25 pounds, we can adjust that. 400 IUs is probably a good place to be. But as they grow up, every 25 pounds, 1,000 IUs is a good place to be for that dosage. Okay. Great. Thank you for all your awesome questions. And thank you all for joining me for this important information. So yeah, we started out by talking about some of the statistics. 50% population could be deficient. The darker your skin, the harder to make it from the sun. Most people can't make enough from the sun. I see clients all the time from all over the world, from a lot of hot places, and they usually have low vitamin D levels. We looked at a few studies, the very strong connection between mental health and vitamin D. Also, if you're interested in really diving deep into mental health and neurology, we're going to be talking about, you can join me in my course. The link is in the Facebook post here. We're going to be talking about vitamin D, of course, but depression, anxiety, ADD, ADHD, insomnia, autism. We're going to be going into the neurodegenerative diseases like Parkinson's and Alzheimer's, dementia. We're going to be covering different parts of the brain, how we increase brain growth, neurogenesis, what is needed for a healthy brain and nervous system. It's going to be an awesome course. So you can join me for that if you want to dive deeper into the mental health aspects. But going back to what we spoke about today, we saw there was a very strong connection between vitamin D and mental health. We looked at a couple studies. One study that looked at 441 Norwegians. When they took vitamin D, depression scores went down by as much as 33%. We also looked at another group of 5,006 people between the ages of 66 and 96, and blood levels of vitamin D were correlated with depression scores. So as vitamin D levels went down, depression scores went up. And then finally, we looked at another quite shocking study of 5 individuals who had myopathies and were in wheelchairs. And when they restored their vitamin D levels, they were basically cured and came out of their wheelchairs within 4 to 6 weeks. Those are just a few examples, but there's a ton of other stuff out there. We also looked at that pain chart. As blood levels of vitamin D levels go down, pain response increases. So very strong correlation with pain. We finished up by talking about how to monitor our vitamin D levels, where to get tested, what numbers to look for, and how to be a vitamin D pro, which I hope you all are at this point. And again, that's why I do these episodes of This Week in the Clinic, to take what I'm using in my clinic on a daily basis, weekly basis, and bring those little pearls to you so that you can use them in your life to live a healthy life and a happy life. And to help those around you, of course, because this information spreads, right? Super important. So I want to thank you all so much for joining me. We're going to be doing This Week in the Clinic again next week, same time, same hour, and I'll be releasing the topic in my newsletter, which is released every Tuesday. If you haven't signed up for my newsletter, you can go to my website, joshgitalis.com. You can sign up there. In my newsletter, I give you my latest current events, we give you replay details, we give you the topic for the next week, and a lot of other information. I appreciate your appreciation. I see all the love coming in. Thanks a lot. I'll see you again all very soon. Thank you for your comments, and I hope you can join me next time. And I always say the best way to get started is to get started. Take care and have a fantastic day.